Good afternoon. I'm Ivana Morgan, graduate student of Acupuncture and Herbal Medicine at the Pacific College of Health and Science, and I'm here to present to you an introduction to Chinese medicine. Chinese medicine is a medical system that dates back over 3,000 years, with ancient texts that focus on the proper movement and containment of essential internal resources, mainly qi, blood, yin, and yang, to maintain health. It is said that Chinese medicine is holistic in nature. It is based on the idea that no single part can be understood in its relation to the whole, whereas each part of nature serves a purpose to its environment, and without each piece doing its job correctly, the environment would be out of balance and perish. The ancients then realized that moderation in diet, consistent balance of activity and rest, and living in accordance with nature were the keys to longevity. Just from observing the structures and functions of the nature of our world, they realized the significance of the wholeness within ourselves, the wholeness of nature, and the relationship between the two, caring for our bodies just as we care for a fruitful garden. The immigration of Chinese to America due to the California gold rush in the 1840s brought Chinese medicine to America. Decades later, in 1880s Oregon, we have Doc Hay and Lung On, who established a very successful Chinese medicine apothecary, Kam Wah Chung and Company, until 1948. This business became an integral part to their community, which was the third biggest Chinatown in the United States at the time. It became a historical landmark in 2005. Many of the historical photos, such as these in the presentation, are shots I took from the exhibit presented at the Museum of Chinese in America. The medicine was generally practiced exclusively in Chinese communities for many years. It did not reach popularity in America until 1970. As the Western allopathic or biomedical view of medicine developed around the 19th century, we begin to see the distinction between Eastern and Western medicine. In comparison, Eastern medicine views the body as a garden, a living organism that receives continuous and attentive care, while Western views it as a machine, which would require repair over time, generally when symptoms appear. Eastern diagnosis is based on the individual's presenting symptoms. So if for example, we're treating a headache due to stress, we would treat it differently than we would a headache due to a cold. Western diagnosis and treatment are based on the same symptoms without taking the individual into account. Treatments from these symptoms would be the same for each patient. Eastern medicine also uses natural forms of treatment, which we'll go into later in this presentation. Lastly, Western medicine uses lab-created pharmaceuticals, which we know tend to produce adverse effects. They also use physical therapy, surgery, which is helpful when necessary, and psychological counseling, which at times we do suggest for those with mental illness while they receive acupuncture and other therapies. Now this leads us into Black history, with acupuncture through activism. In the 1970s, New York City was dealing with a drug epidemic, and in order to get users off of hard drugs such as heroin, the Nixon administration promoted the establishment of methadone clinics. However, the use of this only became just an addictive replacement to heroin, and many felt it did not benefit the community. Black American leaders Robert F. Williams from the NAACP and Huey P. Newton of the Black Panthers had visited China on political agendas to help find solutions to racial disparities. In these cultural exchanges, they learned about barefoot doctors and how they took care of rural communities in China far from modern medical attention. In response to the terrible health and societal conditions in urban communities in the 1970s, community-based organizations such as the Black Panthers and Puerto Rican activist group Young Lords were taking action to provide better services and conditions for the people. They pioneered a community health clinic in the Bronx called Lincoln Detox Center, which focused on detoxing Black and Hispanic community members from heroin. Pictured above is Robert F. Williams meeting with Mao Zedong in 1964, and Huey P. Newton, the Premier of China. Huey P. Newton met with the Premier of China in 1971, shortly before Nixon's visit to China. Excuse me. Around this time, Nixon and other Americans also traveled to China and experienced the useful medical modality of acupuncture. It was around this time more articles on acupuncture began to surface and the popularity increased. Members of these community groups began to learn acupuncture from Montreal acupuncturist Mario Wexiu. One of his students who has been deemed the father of Black acupuncture, Mutulu Shakur, helped bring acupuncture into urban communities suffering from drug addiction. Tired of seeing the destruction of urban society due to drugs, community members, along with Mutulu, decided to try using acupuncture at the Lincoln Detox Center around 1973. From this, they developed NADA, the National Acupuncture Detoxification Association Protocol, an ear acupuncture treatment used to treat addiction, trauma, stress, and mental health. From 1978 to 82, Dr. Shakur became the co-founder and co-director of the Black Acupuncture Advisory Association of North America, also known as BANA, and the Harlem Institute of Acupuncture, continuing his remarkable work and treating thousands of patients who would otherwise have no access to this type of treatment. By the early 80s, the U.S. government had systematically shut down the clinic, through an operation called COINTELPRO, attempting to erase the history of our contributions to healthcare in America and unfortunately incarcerating Mutulu, who is still living today. Thankfully, BANA is in the process of regrouping and returning to the community. So keep your eyes open if you're interested in learning more, as well as checking out the documentary called Dope is Death on the history of activism with acupuncture. I will have more information at the end of the presentation. And now we continue on to the branches of Chinese medicine. We have acupuncture, bodywork, herbology and diet, exercise, and meditation that we'll discuss today. Other branches may include feng shui, which is the configuration of one's environment, and divination or astrology, that act more as fortune-telling and spiritual guidance. But in the interest of time, we will save those for another talk. When I first heard of acupuncture, I was watching the comedy movie The Nutty Professor, particularly the scene where he tries everything to lose weight. And one of those things was acupuncture. Now, this image is over-exaggerated on how we practice, of course, but I have gotten great experience in holistic health as a student, and it opened my eyes and my mind to learn how great and beneficial this healing is. So, what's acupuncture? In a basic sense, acupuncture is the insertion of fine needles into specific points around the body. Most of the points we choose run along sets of channels along the body pictured here. I like to think of these channels as subway lines that lead you from one part of the body to another, and the stops and stations along the way are points that can be needled to access the qi or energy of that channel. Each point can regulate qi, blood, yin, yang, and other resources, or affect pathogens, in order to restore proper balance to the body and mind. Acupuncture and all of Chinese medicine is available for everyone. It can be used for a wide range of issues, including pain and injuries, digestive disorders and weight loss, women's health, men's health, mental health and addictions, skin conditions, asthma and allergies, the immune system, common colds and flu, pediatrics, and the list goes on. According to the U.S. Department for Health and Human Services Office of Minority Health, compared to their white counterparts, African Americans are generally at higher risk for heart diseases, stroke, cancer, asthma, influenza, pneumonia, diabetes, and HIV/AIDS, and more. However, by incorporating the practices of holistic medicine, we can have a higher chance of preventing these issues the sooner we start. For instance, with diabetes, acupuncture can help balance blood sugar and reduce the need for medication, which can cause side effects. For asthma, it can help decrease the phlegm and strengthen the respiratory system to lower incidence of acute attacks. Acupuncture can also help reduce blood pressure that can cause stroke and heart disease. And like we've seen from our history, it can also be used to stave off cravings, as well as disease withdrawal symptoms and substance use disorders. Even without these symptoms or health conditions, this medicine can give you more of a sense of relaxation and better emotional health than practicing no healing therapy or using drugs. Of course, with these issues, it's best to consult with your primary doctor or specialists in tandem with seeing a Chinese medicine practitioner so you have a well-rounded guidance and supervision in changing medications, treatment, or lifestyle. Some tools in addition to the needles you may see at your acupuncturist office may include moxibustion, which is the use of ignited mugwort, an herb, to bring heat to the areas of the body. It is used to help warm and circulate energy. Electrical stimulation may also be added to your acupuncture treatment to help treat chronic pain or acute pain. We may also use ear seeds, which are either special plant seeds or metal pellets adhesed to the outer ear over a few days to help circulate energy. Here we can see some ear seeds that are made with Swarovski crystals for a fashionable effect. Later today, Vlad will be speaking with you regarding herbology. However, for the moment, this is a often used modality with acupuncture as it complements your treatment from the inside out. As an herbology student in our school clinic, we may prescribe raw, granule, or pill formulas that are safe for use and are of high quality to produce effective therapeutic results. Other forms of herbal medicine may include decoctions, teas, alcohol or water-based tinctures, washes, topical liniments, ointments, creams, oils, syrups, or essential oils. And here are just a few photos from my life as an herbal student. Camwell on the left is a long established herbal dispensary in Chinatown where one can get herbs and more. The photo at the bottom is an example of what private herbalist stock may look like when they make herbal prescriptions. And to the right are two huge textbooks I've studied from over the years, trying to remember everything I can about Chinese herbs and how to prescribe them to my patients. The key to healing is to integrate wellness into everything you do, or at least try to, and that includes all that you eat. Some of the foods that we use as medicinal herbs are also common foods for everyday meals as well. That is because the natural foods of our earth hold energetic properties that can help regulate our health, just as herbs and acupuncture do. So there may be particular times and seasons or reasons to eat certain foods for the particular benefits they offer. For example, I like to have a nice juicy pear for a dry cough or a dry throat, especially in the fall. Not only are they in season at that time, but the energy of the pears benefits the energy of the lungs, and the lung symptoms tend to manifest in the autumn season with drier weather. The more you delve into Chinese medicine, you'll learn more about the elements and the relationships with the body and nature. One thing to note is that eating produce according to the proper season that they're naturally harvested in ensures the optimal amount of nutrients they hold. There are a few apps you can find online that'll tell you when certain fruits and vegetables are in season, such as the Seasonal Food Guide. When you see a Chinese medicine practitioner, they can also speak with you about the best foods to eat in general and for any particular condition you may be dealing with. And here's everyone's favorite, body work. There are several manual therapies other than acupuncture that manipulate the physical body to restore the balance and flow of qi throughout body's channels. We have Tui Na, which translates to push and grasp. It utilizes traditional Chinese massage techniques incorporating deep tissue compression, percussion, vibration, lymphatic drainage, soft tissue and joint mobilization to rehabilitate muscles, joints, and connective tissues. Next, we have gua sha and cupping. Oops, sorry. There we go. Pardon me. Next, we have gua sha and cupping. These techniques use tools to increase blood circulation, decrease inflammation, boost the immune system, drain the lymphatic system, increase muscle function, release tight muscles, and break up adhesions. For gua sha, translating to scrape sand, the practitioner uses a small tool which may come in several different forms, including stone, like a jade stone, horn, porcelain, or metal. Cupping uses either glass, plastic, or silicone cups that are suctioned onto the skin. Cupping and gua sha tend to create reddened marks, showing that the blood has been brought up to the surface of the skin. This is an appropriate response, and these marks basically show how much stagnant energy is within the tissues. The marks usually go away within hours to a few days, depending on the strength of treatment and the stagnation within the body. These therapies are becoming very popular in mainstream media, as we see a great deal of celebrities like Dwayne "The Rock" Johnson, Kim Kardashian, Lizzo, and many other famous athletes benefiting from this traditional healing technique. Movement is very important, and in Chinese medicine, by moving the body, we can move qi. This is beneficial because as we prevent our energy from stagnating, we can prevent illness. These two practices, Tai Chi and Qigong, are slow moving and low impact, which are great forms of exercise for senior citizens as well as those in rehab from cardiovascular diseases. Along with meditation, these practices promote health and well-being through harmonizing the body and mind. Here I have a list of resources here for anyone who's interested in learning more information from this presentation. I will add the links to the chat if we can. Otherwise, we can also send them to you another time. So I'll start with my school. Pacific College of Health and Science has a free podcast that features interviews and conversations on the latest research about the uses of diet, exercise, herbs, nutritional supplements, and other healthcare practices to promote optimal health. Acupuncture Today is the leading publication in the field of acupuncture. It's a wonderful newspaper. The National Acupuncture Detoxification Association trains people in the NADA protocol, which is an ear acupressure or acupuncture treatment for trauma, substance misuse, abuse, dependence, and related behavioral and mental health conditions. They advocate for the community to access holistic health. Dope is Death is a documentary on the radical movement that sought to end heroin addiction in communities of color with acupuncture. For more on Dr. Mutulu Shakur and Ivana, you can visit the webpage listed here. And separately, the Black Acupuncturist Association hosts regular virtual meet and greets with Black acupuncturists, as well as educational events about race and acupuncture. You may subscribe to the BAA YouTube channel to learn more as well. The Museum of Chinese in America was founded in 1980 and celebrates the living history of the Chinese experience in America by preserving and presenting the 200-year history, heritage, culture, and diverse experiences of American communities of Chinese descent. And they're located in Chinatown, New York. I want to thank you so much for listening and watching. I hope that this has been helpful to you as well as our community. If you have any questions or comments, feel free to reach out to me by email at loveonhealth@gmail.com. Thank you.